Welcome to the Prison Pod, a podcast for all people experiencing incarceration. The mission of this podcast is to save lives, restore hope, reduce suffering, and recidivism. Many show ideas come directly from the listeners, so please write the host. Prison Pod, Post Office Box 294, Orono, Maine, 04473. Here is your host, Ms. Valerie.
Welcome to the Prison Pod. In the studio with us today is Daniel A. Rosen. Daniel is a justice reform advocate and writer who was also incarcerated between the years of 2015 and 2021. He has previously worked with Worth Rises and is currently very involved with the Coalition for Carceral Nutrition. Prison food is often described by many as barely edible. Today we will open up the conversation around food, health, mental health, and rehabilitation. Welcome to the Prison Pod, Daniel.
Thanks very much. I appreciate you having me and covering this issue too.
Well, since we're talking about prison food, let's talk a little bit about what your experience was with prison and prison food.
Yeah, thanks. I think it's a good place to start. I'll tell you, before I was incarcerated, I actually had a fairly major health scare, and it really caused me to change the way I look at food, the way I look at my health, as these things kind of do. Sometimes I think I was, in my early 40s, and that forced me to reevaluate, I think, my own health and my own, the way I was eating, and how it affected my health. And then I got incarcerated and quickly came to understand that it was going to be very difficult for me during those years to eat in any kind of way that looked like healthy, to protect my health, not, to try to keep it from deteriorating any further. And, I did what I could while I was incarcerated, and the options are limited. The mainline food service, the chow hall food service everywhere I was incarcerated was pretty bad. Although not as bad as some places, I've come to understand since I've come home. And the canteen options or commissary options that were available to most folks, not much better. Unhealthy, but in different ways unhealthy. And so I did what I could. I think anybody who's been incarcerated will understand that sometimes there are other opportunities besides just food service or commissary. There are, there are opportunities for, what the facilities might consider contraband, but, you find what you can to protect your health and to eat as well as you can. And some of that took resources, but that was something that I was invested in, was trying to do that and protect my health.
So you have a very good understanding of what your typical prison diets are across most of the correctional facilities in the country.
It's so hard to generalize about these things. And I'll get these calls or messages from folks that said, well, where I was locked up, it was pretty good in this place. I had a call from somebody at a jail in Portsmouth, Virginia, a couple weeks ago, and he was telling me that the food was pretty good. And he gave me some examples, and I was surprised to hear them. But it's a small facility, 100 people or so. And you contrast that, I think, to some of the larger jails in this country or some of the larger prisons. I was at one prison facility in Virginia that was about 3,000 people. And scale makes this problem harder. Generalizing is just difficult because people's experiences of incarceration with food and everything else just varies so widely. But in general, I think what we know, and what all the studies in this area have shown, is that prison diets and prison food tends to be very unhealthy. We tend to feed people in those facilities, whether it's jails or prisons, in all the ways that we really know are unhealthy. Empty calories, very starchy. We don't feed people nutrient-dense foods. We don't feed people fiber-rich foods. We tend to feed them if there are vegetables, they tend to be starchy vegetables. And then most everything is very highly processed. Ultra-processed foods are kind of the basis of most prison diets. And it's kind of appalling because any prison or jail that wants accreditation really has to have their menus certified and signed off on by a dietitian, and that's one thing that they'll always fall back on. And yet, if you look at the end result and the trays that come off the serving line, they look like things that nobody on the outside would ever want to eat. And beyond unpalatable, just unhealthy in all those ways of empty calories. They'll talk about calories a lot. I talk to the DC jail folks a lot, both residents and administrators, and they like to talk about, well, we're meeting the calorie standards. And calories are just such a measure for nutrition. Really no dietitian or anybody who cares about food and health would ever use calories as a basis for determining nutrition. But that's kind of a real rough measure and the way a lot of facilities do tend to think about things. Are we feeding them enough calories? Well, I mean,
Well,
as you know, you can pile up a stack of cake and white bread and get to a certain calorie threshold if you want to. And some of them
well,
do that.
you've examined food as part of a broader system. And how does nutrition intersect with dignity and human rights behind bars?
Yeah, thanks. I really appreciate that question. I think it's hard to overstate how much the way people are fed affects their sense of self. I mean, if you hand people, if the state or the county hands people a tray of slop 3 times a day, it tells them exactly what it thinks about them. It tells them what their value is. And I think, speaking from my own experience, I think some of that starts to be internalized. We spend a lot of time talking about the effects of food on people's physical health, but the effects on people's mental and emotional health, I think it's hard to overstate. When you show up at the chow hall or the trays show up on the housing unit, and once again, it's just a pile of nothing you want to eat, but you got to eat something. You're going back to your commissary box and spending more money because what the state handed you was so inedible. It's amazing how much food I saw end up in the trash in a lot of the facilities I was incarcerated in. We don't talk a lot about the food waste and the environmental impact of that, but the food waste is enormous when people are fed. We talk about this from an economic standpoint, from a health standpoint, but I think we don't really talk about it enough from a dignity and agency standpoint. When you go to jail or prison in general, you lose a lot of personal agency. Then I think you're handed a tray that kind of further dehumanizes you multiple times a day. And so you'll do a lot to get any bit of that agency back, even if that just means going to your commissary and making a meal for yourself, even if it's nothing great. It's probably better than what the state handed you on that tray in the first place. So this thing, I think the food piece is fundamental to people's sense of self. I think in the way that work is, food certainly is, and it's how we think about ourselves. Yeah. And people who spend years and decades being fed that way, I think they come home and we expect that they're going to make good choices and be productive and be healthy and be ready to rejoin society and rejoin our communities. And I think we're undermining that the way we feed people every single day.
Well, something too that I just recently started thinking about is how many people were food insecure before they went to prison. So many people that have grown up in poverty, people that have been in the foster care system, people that have lived in homeless shelters. So they've already gone through food insecurity and have trauma around food. And then their food is limited even more in prison.
Yeah, I think
So
that's right. The disturbing part is I've heard jail and prison administrators say that as almost like an excuse. Well, it's not a problem that the jail or the prison created. This was the case when, when folks came in, they'll say, well, they didn't have good eating habits. They didn't eat nutritious food. But I think what you're pointing to says, a lot of times people don't have that opportunity. They don't have that. They live in food deserts. They live in food insecure areas. They live in, their own economic situation doesn't allow them to eat the way they might want to or protect their health the way they might want to. And then they go to jail or prison and we make it worse. And I think that's, for me, a really basic criteria. Are we making it better or are we doing more harm? In the vast majority of cases, for most people, we're doing more harm. And they're leaving worse off than when they got there. In a lot of ways, but certainly with regard to their health and nutrition.
we're going to take a brief break here just to bring a message from our sponsor, and we'll be right back. Okay, I would like to know if there is any coalition between diet and addiction that you're aware of.
Yeah, it's a great question. You see me smiling, your listeners may not. It's something I've been actually thinking quite a lot about lately, and thinking together with other folks in this space about. There's a lot of new research in this space around diet and addiction. And I think two different things about this. One is we know that ultra-processed, poor diets feed addiction and feed addictive behaviors. I think that's what the research is starting to tell us, that those ultra-processed foods in particular rewire the brain to be more susceptible and more to engage in more addictive behaviors. And the other part of it is just when we're trying to help folks beat addiction. And listen, lots of facilities have recognized that medically assisted treatment is a valuable thing. They've understood that substance use disorder is something that we can treat and need to treat in those facilities. But I think diet and really whole foods, healthier foods can be an important aspect of helping folks get over addictions and beat those substance use issues. And we're not doing it. I mean, to be clear, we're not doing it. I was talking to a dietitian at a major jail recently and just thinking with them about, we have all these diets in prisons and jails. They have, all of them have numerous medical diets, religious diets too, but thinking about medical diets for high blood pressure, diets for diabetes or prediabetes, diets for people with renal disease. Every jail and prison that does food service, and that's all of them, has those kinds of medical diets, but we don't have a medical diet that addresses the number one biggest problem we face in jails and prisons, really, which is addiction. And we've recognized that addiction's a medical issue. We're treating it medically with medication-assisted treatments. This is not a personal failing, right? We understand now that this is an issue that we can treat medically, but we're not using dietary interventions to do that. And that's a huge missed opportunity. And it is, like I said, I remember sitting on my bunk one time, and I was in a dorm, and I'm just counting the 10 people around me, 6 of them with addiction issues. And that tends to track with some of the kinds of numbers we see about addiction in jail and prison facilities. It really kind of blew my mind to just sit there and literally count the bunks around me and who was using. And yeah, it's something that we ought to be looking at and ought to be addressing through the same kinds of dietary interventions we do with all kinds of other chronic diseases. And those chronic diseases are much higher incidence in prison. We know this. There's not a ton of great research, but we do know those chronic diseases are much higher in prison. And we can talk more about that kind of health piece and medical piece if we want to. Addiction. I'm so glad you raised the addiction thing, though, because it's really been on my mind lately.
I've been thinking a lot about the whole rehabilitation piece is, healthy mind, body, and spirit. If you don't have a healthy body, how do you have a healthy mind? You don't think clearly. You have the medical issues. And for people that have the attitude, and we know anyone who does prison work, there's people out there who say, well, why should I care? Well, let's break it down to dollars and cents.
Yeah.
We have a huge aging prison population right now across the country. It is a problem. And with our elderly prison population, we have an unbelievable amount of high blood pressure, diabetes. You have people that are no longer physically moving, so they're in wheelchairs. There's so much that could be prevented with proper diet, nutrition, and exercise. So there's those areas. The other thing is I don't know how many prisons or jails you visit, but I've visited a lot. And it tends to be out in the middle of no man's land where they can put up farms, greenhouses, gardens. I do not understand why there are not more prisons producing their own food in-house, along with teaching agricultural services to the people that are residents there.
Yeah, you just said a lot there. So let's talk about both of those things. I think it can be difficult, to get a handle on some of the numbers, but let me start with this. We are, I think, recognizing this, the political discourse in this country in general, out here in the world, has really started to refocus on this question of how much food and nutrition affects our health and our healthcare and our healthcare costs. And that's a conversation that is also now including prisons in some ways. I mean, when the secretary of a major cabinet agency starts talking about school lunch and prison lunch in the same breath, it's really interesting. Let me throw a couple numbers out there. We know that diet-related disease tends to create about 60 to 70% of our healthcare costs. And we also know that incidence of diet-related disease in prisons, especially obesity, heart disease, hypertension, diabetes, those things really are the driving factors behind chronic diet-related disease in prison and jail settings. I think, my own kind of back-of-the-envelope calculations tell me that we're looking at tens of billions of dollars that we're spending just by feeding people badly. And to narrow the aperture a little bit, most corrections agencies spend about 20% of their budget on healthcare. I mean, the largest percentage of any corrections budget is staffing, always. But healthcare is usually second, 20%, sometimes more. Food tends to be low single digit percentage, 2, 3, 4% of agencies. And there's a direct correlation between those two things, right? When you spend that little feeding people at the kind of low quality that you're feeding people, you're driving up your healthcare costs on the back end of that equation. And I think, to some extent, that's a short-term, long-term problem. Agency budgets for food, for lots of things, but for food tends to keep driving downwards because, among other things, healthcare costs keep going upwards. And corrections agencies are not exempt from that. Their healthcare costs are eating their budgets. And so they tend to drive down other things that they can, like food costs, into these low single-digit kind of numbers. I think I was looking at Virginia a few years back, 2020, I think it was. They were spending $250 million on healthcare in their corrections system, $250 million. And they were spending about 24 million on food service. And that mismatch is really, there's an equation there, right? Those things are absolutely directly related to each other. It's just a short-term, long-term problem. And those, the health effects, I think you're right, what you were just saying about the aging population in prisons. We're going to see that those kinds of numbers keep getting worse as our prison population ages and we start spending, even more. Agency budgets are going to get eaten even more and more by rising healthcare costs. Food costs are rising, but agency budgets for food aren't rising. And that's, that's another problem. I think we continually see quality go down because food costs are rising. A lot of those contracts are fixed price contracts. And so whoever's providing the food service, particularly when it's a private sector provider, the food's not getting better. I want to talk about the other thing you said, though, and if I can jump to that, which is
Yes.
Jails and prisons used to pretty much feed people what they could grow and buy locally. It's not that prison food was ever, or jail food was ever great, probably. I think I'm not trying to harken back to some good old days but I do think what we have seen is a system that's increasingly centralized, increasingly highly processed foods, increasingly privatized, where there isn't that kind of local procurement anymore of what you could either grow or buy locally. And that's really where things were 100 years ago. We didn't have the size population. We didn't have the scale of problem that we have now. But we do see many places where there are agricultural programs where there, as you said, prisons, especially, not so much jails, especially not big city jails, but in prison facilities where they are in rural areas, a lot of them do have agricultural programs or better yet, even horticulture programs, culinary programs, all kinds of programs around food. I'll start out with the kind of obvious problem. I think there's a lot of places in the South where people are laboring, usually for free, in agricultural operations that they do not benefit from themselves at all, where the food is going outside the facility. Even if the food is staying inside the facility, that's rare. Most food grown on prison grounds does not stay on prison grounds. There's a couple of exceptions to that. Yeah, but a lot of times it's going to food banks. Mm-hmm. It's getting sold at market. If it's valuable, it's getting sold at market. But there are former plantations all over the South where people in prison are laboring under the gun, and it looks a lot like it did disturbingly 200 years ago. And that's a real problem. I think I don't want to be sitting here speaking favorably about the kinds of agricultural programs we see at a lot of big prisons all over the South. I mean, it's not limited to the South, but it's primarily a problem in the South, especially since people are forced into that labor. They are not given a choice about it, and they are not paid for their labor at all. We also see programs, I'll point out Maine, where you are, which is kind of doing things right. They've been a leader in that space in promoting regenerative agriculture, growing what they can use in their facilities, donating what they can't use. But really cooking from scratch, producing what they can on site, buying the kinds of things that local producers have available that those producers can't necessarily sell easily to markets. Maine has a farm to table coordinator. in their Department of Corrections. That's fantastic. And it's important to have somebody who wakes up every day and thinks about that. And I'll shout out Mark McBride because he is doing a great job up there. But there's not that many Mark McBrides around the country. There's not that many Maine DOCs around the country that understand that kind of local system of procurement matters, and it results in feeding people in more nutritious ways. It also results, honestly, in better outcomes for Maine farmers and Maine producers because they have institutional markets available to them who want their stuff that they can't even necessarily sell to a grocery or another kind of producer, and it might be kind of seconds or whatever, but it's still stuff that the corrections agency is happy to get, quality stuff. Mark gets a lot of cheese pieces ends that get cut off when they're, when producers are packaging stuff from markets, or he gets run-of-the-mill grain from granaries that have excess. And so that kind of thinking around local production, around how you use those institutional markets to spur local economies and to do things that are good for local farmers and producers it's the right kind of mindset. There's just not enough states doing it. I'll say the scale of the problem in Maine, or the scale of the system, the carceral food system in Maine is small. It's less than a couple thousand people. Maine's entire jail and prison population, I think, is less than DC's jail. I'm in Washington, DC, and our jail here, a large urban jail, has more people in it than Maine's entire state system. So scale is part of this equation too.
I think it's really good, though, that Maine has done so well that there's an example that they can use and say, look what Maine is doing. Can we at least try to start something like this in other places?
Yeah, I wish there were more examples. That's part of the problem. And some of that is the Corrections Commissioner in Maine does a great job of proselytizing to some of his peers and colleagues around the country at other corrections agencies, but he's one guy. And, I think we need more of that kind of leadership, and leadership's a big part of it. We can get into the nitty gritty of procurement and some of the real weedy stuff, I think, that affects this problem, but leadership is absolutely critical here.
I think, with the whole idea about growing food, it's one thing we definitely need to go back to, we're having less and less of it all the time. Farmers, if we don't, especially right now with the whole thing with immigration and migrant workers that we have depended on in this country for many, many years to get our crops in and to harvest those crops on time and to process them. Those are things I think that we could be incorporating in our prison systems as far as our future, and the idea that the men and women are involved in such an important thing, that they have the understanding of what they're doing matters. And I think that's something else that, goes along with the dignity and respect in prison is we all want to feel like what we're doing in life matters to something. Someone is going to benefit, or that, I think the majority of us want to be a positive piece of life, even in prison, So I think that if they were helping, and the other thing is canning. We don't hear about it as much as we used to, but the canning processes, that could be being done where they have fresh fruits and vegetables all year long that have been grown. So
Yeah, we don't
so
do a lot
many.
we don't do a lot of that in prison facilities anymore. I'll tell you,
No.
Virginia used to have a big operation called State Farm, and there is still a State Farm, but it is radically reduced in scope. And I think what you're talking about, also coming back to the issue of dignity and agency, when people are involved in growing their own food, and maybe they never have before, maybe that's not the kind of community they come from, but it gives them, you're right, some sense of agency and control and dignity over what they're eating and what they're doing with their days. And that's worth a lot. It also comes back to this, I think, in Maine, there's, I think, a very strong idea about a right to food. And I think Maine's the only state that has a constitutional amendment around the right to food. No other state that I know of has done that. But that extends also then to folks, I think, who are incarcerated, and to grow their own food, to eat what they grow and not see it just leave the facility. Or just like some places where it just goes into the officer's mess, and it ends up in the officer's dining room. And if there are salad greens being produced or something, that's where it ends up, and not there to serve or feed the incarcerated people in that facility.
One thing that we haven't talked about, I want to make sure we do talk about, is your work with the coalition of for Carceral Nutrition. What is it that you guys do, and how can people find out more about what you do?
Yeah, thank you. I think, for me, when I came home, I started working with some local advocates around food issues in the DC jail. Um, Started educating myself. I think one thing, as someone who was incarcerated, my task when I came home in some ways was to understand how my experience was different from other people of incarceration around the country and how it was the same as other people who were incarcerated. And there are a lot of differences. But one of the things that I kept coming back to was this issue about food when we're looking at conditions of confinement. And listen, people have said to me, really, food, is that the thing that you want to work on? Is that our biggest problem in jails and prisons? And that's it's a funny question. I usually just ask, it's like, tell me you haven't been locked up without telling me you haven't been locked up. Most people care what they eat, whether you're in a jail or prison or whether you're just out here in the world. I guess there's a few who don't, but most people do. And so if you don't understand that daily deprivation, that daily reality of food insecurity really, I think, is the only way to describe it. People think of people in jails or prisons as being food secure. Well, they get 3 hot meals a day. That's generally not true. A lot of places do 1 hot meal. But food security is a funny thing in a jail or prison where you are handed a tray, but a lot of it is inedible. And so I think that is.
Well, we ran into a little bit of a technical glitch last week, so we're rejoining our conversation on carceral nutrition. So I'm thankful to have Daniel Rosen back with us today. So, Daniel, I think we were just getting ready to talk about what you do with the carceral nutrition and your reasons for it.
Yeah, thanks. And I appreciate the question. I think when I came home about 4 years ago, a little more, and started looking at how I wanted to use that experience, there were lots of things wrong with our prison system. And for a time, I worked on issues around prison labor, issues around solitary confinement. And I really started to see that some of the issues around food and health just are so fundamental to how we see ourselves, how we, just kind of like work too. I think these are how we eat, what jobs we do. These things are kind of fundamental to our sense of self. And I started to really understand how my experience of health and nutrition inside, how it matched or did, how it was the same or how it was different than other folks and their experience of those same things inside. And just really saw that there wasn't a lot of attention being paid to this issue. And so a couple of years ago, myself and a partner in New York started this nonprofit, Coalition for Carceral Nutrition. And I think our thinking has evolved about it over time, but we've done a lot of learning over the last couple of years. We've done a lot of thinking about what needs to be done in this space, looking at what's already been done and it is happening and what's not happening. And now I'd encourage your listeners to go to our website, carceralnutrition.org, to sign up for updates, to follow us on social media, mostly on LinkedIn, not so much other platforms right now, but all of those platforms we're on there at Carceral Nutrition, all together, all one word. And I think to get more involved in this issue, as I came home in reentry, and I know a lot of other folks have talked to about reentry, there's a lot of, rightfully so, a lot of focus on jobs, a lot of focus on housing. These are the first things people think about when they come home. But I've also seen how people's health looks coming home. When I came home and spent some months in a halfway house, a guy came in just a couple weeks after me, and he'd come from 25, 30 years in the federal system and came out with so many diet-related diseases, other chronic diseases. And we see people coming home sick, I think, a lot. And so those housing and jobs questions might take immediacy, but it's hard to do any of those things if you're not well and you're not healthy. We're understanding, I think, better these days how much food and nutrition play a role in that health. And so I think there's a lot of work to do, both inside the walls and how people are being fed inside, but also, even looking at how this extends into people coming home. Those years inside can, I think, really take a toll on people. Eating this way, the way most prisons and jails feed people, I think really can take a toll. And we see that with folks coming home with all kinds of chronic diet-related disease. We've been talking about around obesity, around heart disease, around diabetes especially, but lots of other things that affect their health too.
I think too, a lot of people that come home, they go to one extreme or the other. They never eat another ramen noodle in their life, or they eat exactly the way they ate in prison. You take them to the grocery store and they buy the same exact things they bought on commissary. And that's a terrible sign of institutionalization, but also the idea that that unhealthy diet continues when they go home. So I think that's another area where if we had those nutrition classes and the guys and women were cooking inside and preparing the food from scratch, cutting down a whole chicken, because it's so much cheaper to buy a whole chicken than chicken pieces, all those different things that affect us. And you know, the old saying, we are what we eat. When if you're feeding somebody the very minimal for nutrition and calories, what's the end product going to be? You know, how's the mental health along with the physical health?
Yeah. And I think, especially for folks who are inside for a long time, we can't expect them to eat that kind of as badly as people do eat inside and then come home and make good choices about their health and nutrition that'll serve them well in reentry. Like you said, some of those habits could start inside. Some of that nutrition education and health education could be done inside, and it could be done around better food that people are eating in the first place. I mean, there's very little choice, obviously, when it comes to a prison diet, except with commissary. Commissary is unaffordable for a lot of people. For the most part, commissaries offer really unhealthy alternatives to regular prison meals. Shelf-stable, high-sodium, packaged, ultra-processed foods available on commissary. It's not like commissaries are really offering fresh produce, although we'd love to see that. There's some good work going on out there. There's been a few farmers markets at some prisons in California. I just had a conversation yesterday with somebody at San Quentin about wanting to start a produce co-op market on site. So really interesting conversation. In New Jersey and New York, as I understand it, some of the care packages available, there are opportunities to include produce, although it tends to be very limited. I think there are, and I know in California also, I hate to keep going back to that but there's like a harvest of the month program where organizations are bringing in a new product, fruits or vegetables every month. So, I think these opportunities are out there. These programs are starting to pop up, with some good practices around the country that could be replicated to bring especially fresh produce inside facilities that are not getting enough of it. That's, there's lots of issues with the prison diet around ultra-processed foods, around starch, really starchy foods, and nutrient-dense foods are really generally minimal. But I think, rightly so, fruits and vegetables and fresh produce is always the focus of a lot of conversation about what's lacking.
There was a facility here in Maine at one time during the summer. They did outdoor visits where you could go out to a picnic table and you could bring food, which was great, to be able. And I can remember one day just bringing fruit, a big thing of strawberries, big thing of blueberries. That's all they wanted was fresh fruit. And that's what we did. We sat there for 2 hours and ate fresh fruit.
And yeah, and I think as I've talked to some prison administrators, they say, well, these guys just want junk food. They just want burgers and pizza and French fries. And I think, sure, people have a lot of different wants and needs and desires around food. It's not all about kale and broccoli, but I do think there's plenty of people I've talked to who also, like you said, they just want something fresh, something grown from the earth. People miss a lot of things, especially if they're locked up a long time when it comes to different kinds of foods. And that, that agency is important, I think, for people to have that choice about what they eat. And that's why, I think a lot of people do turn to commissary just to feel that agency if they can afford it. But yeah, I think plenty of folks we see with survey responses and, in conversations and interviews and research, absolutely people want fresh food and fruits and vegetables especially.
Yeah. Well, one thing I noticed too is every once in a while, I'll do a fundraiser around the holidays to do order outside packages to go into the prisons. You used to be able to get the little things of tuna fish for $2.29, and they're almost $5 now. And I mean, they're about a third of the size of a can of tuna in a little foil pouch. And it's
a couple of ounces of tuna. Prices vary pretty widely. I would direct folks who are interested in that question to the appeal as an organization, put online a database of commissary prices all over the country. And they just really collected the lists from every state. And it's a really interesting look. The other, the issue is not just the cost, but the quality. And most of what's available in prison and jail commissaries tends to be the very lowest quality foods, off brands, or the commissary, some like Keefe Commissary has, which is owned by TKC Holdings, also owns a food service company. They use their own in-house brands. They essentially produce stuff themselves, and it tends to be the lowest quality stuff that would never fly on supermarket shelves. So they make comparisons about, well, supermarket prices have gone up and ours are comparable, but the quality is nowhere near comparable. So these things that are overpriced in the first place also tend to be the lowest quality, small portions, and still unaffordable for a lot of people anyway. Those are always the most expensive by weight, the healthiest things. Whether it's trail mix or tuna or fish of any kind, the cheapest things are always the junk food.
I forgot where I was going to go. Sorry. So people I know what I was going to say. So many times people say to me, why should I care? They're in prison. Who cares? And the way I always come back and get the best response out of people like that is it's going to save you money in the long run. So if you feed people in prison better, it's going to reduce the mental health and physical health costs later on down the line. So the other thing is if they do in-house raising of food, chickens and eggs, gardening, then they have their own products. They learn how to process it. They learn how to cook it. And those are skills that can be used later on. So if somebody asked you, why should I care? What would you say?
Yeah, it's a great question, because I think my initial response is not where everybody's coming from. I mean, I think everybody deserves a decent meal. I think human beings deserve and really have a right to decent food. Whether, we care a lot about what school kids eat when it comes to school lunch. We tend to care what people eat who are sick, who are malnourished, who are living in food deserts, just as a matter of basic human dignity. But I have many, many times heard these comments from folks about, well, you do the crime, you do the time, and people deserve whatever they get inside. And my first answer to that is always the time itself is the punishment, and the conditions of confinement, whether it's food or health or what kind of mattress they're sleeping on, are not supposed to be the punishment. I do think those things matter to some people, and to other people, they have not experienced incarceration themselves. They've never had a loved one incarcerated, and so they don't really feel that personal connection to the issue. Even for those folks, I would say some of the things you've said, the cost, the public health costs and the economic costs here are very high. We are saving a few pennies on the front end, and I think paying for it in big ways on the back end when it comes to people's health, to the burden on taxpayers of supporting those folks' health when they come home. We are literally feeding people diet-related disease on an everyday basis, in the most literal ways. And so to save a few dollars and then end up with an inordinate number of people that have diabetes and have heart disease and have all of these chronic health conditions is costing taxpayers huge amounts of money on the back end. We know that, 60-70% of all of our healthcare costs can be attributed to food and nutrition, really, when it comes down to it. And so that's only the worse we'd feed people. That's only more true. And so even from an economic standpoint, what we're doing with food service inside jails and prisons just does not make sense. And I think we need more research. I think there's some great studies out there on school food and like the real cost of school food when we're, if we're feeding kids for what every dollar spent, how much it saves on the back end on healthcare. And I think we need some of those same kinds of studies when it comes to prison food. We don't really have them in that space. Sorry to interrupt you.
It's funny because I was just going to ask a question that would have been the answer to, so now I don't have to ask it.
Yeah.
So if somebody who's listening to this on the outside says, hey, I'd like to do something to make a change, how do they go about getting involved and seeing that there's more nutritional and better foods in the prisons? Yeah,
I think that's a great question, because we don't have a lot of avenues for people to directly affect this issue of what people are fed inside. I think the first thing is, I talk a lot about we need to change the tray. And I think we will not have a lot of success in changing those trays until we change the kind of public discourse and narrative around this issue. I think legislators have to understand that people care about this. For the most part, People incarcerated are hidden behind prison or jail walls. Their loved ones, their family members may not have a lot of, a lot of clout when it comes to state legislatures. But I think people have to make their voices known on this, and families of incarcerated people need to talk to their legislators about about the fact that this matters to them, about the fact that someone's paying attention to this, that we can't just keep doing this check the box and yeah, somebody got fed today and it doesn't matter what it was. I think that narrative and that public discourse around this issue, and listen, we're in this kind of weird Maha moment where Make America Healthy Again is a thing, and people are paying attention to food and what we eat. And that is something that really even crosses political lines in a lot of ways. And I think that idea that, what people eat really affects their health. We need to, I think, make it clear to folks who write laws, folks who run prisons, that we're paying attention and that it matters to us, and we want people to come home healthy, to be able to come home to their families, to their communities healthy. I think we're just at the front end of trying to define what some of those actions might look like. We got this system where it's so spread out, right? 50 different states do things 50 different ways. 3,000 plus county jails do food service and lots of other things however they want to, effectively. And so some of that fight really has to happen at a state and local level, because that's where those systems exist. But some of this, I think there is a bigger picture here, and that's one thing my organization is trying to get a handle on, really wanting, I think, to give out grades. I think we're going to start doing that with state systems so that folks can see what this looks like. I mean, listen, nobody gets an A, but some states might not get an F. Some might get somewhere in the middle. And I think it's the kind of visibility across the country that we don't really have it right now. And that's one of the reasons we got involved in this space, is just because these things stay behind those walls, and it's hard to get visibility of them. I would say stay informed with the folks who are doing this work. Impact Justice in California is doing great work. Center for Science and the Public Interest is doing great work here in DC. But look into what's going on in your state. In Oregon, there's organizations that are doing food rescue and bringing that excess food to prisons. In New England, I know there's some good work going on around local procurement and local purchasing, and talk to your local farmers market. Ask them if they're doing any work with giving, food rescue. Anything. Listen, supermarkets, farmers markets, there's always food left over. And sometimes those things are going to food rescue organizations, and it's great. I'm not mad at that. But there may be opportunities to bring some of that food that's left over into facilities like this too. Yeah, so there's a lot of that work is at the state and local level. And we're trying to figure out how we support some of those efforts too.
That's great. Well, I want to thank you for the work that you're doing and bringing this to people's attention. Could you give the website one more time?
Yeah, absolutely. Carceral Nutrition. That's carceral, meaning jails and prisons. Nutrition. Carceralnutrition.org. All one word.
Okay, great. And I want to remind
talk to me. Happy to talk about this further. info@carceralnutrition.org. I'd love to talk to anybody who wants to get involved in this fight.
Okay, great. And I want to remind our listeners that there are a lot of people out here that do care what's going on in the prisons. I've had almost 100 guests on the Prison Pod now, and everybody who's here is here for you. We are all here trying to make things better for the people that are inside and to give better understanding to the people on the outside. I want to thank again Daniel Rosen for joining us today from Carceral Nutrition.
Thanks
We'll be back again with another edition of the Prison Pod next week.
Thanks so much. Thanks for having me.
You have been listening to the Prison Pod, a podcast not just for those in prison but for anyone who has been affected by incarceration. Ms. Valerie would love for you to write to her with your questions, comments, and show ideas. The address is Prison Pod, Post Office Box 294, Orono, Maine. 04473.